Hello, everybody. Thank you so much for joining us today for our webinar on addressing the needs of diverse caregivers of children with challenging behavior. Your presenters today are Annie Maldonado and Bethany Jorgensen. Before I present them, I just want to go over a few key reminders. We will be having the presentation from 2 o'clock to 2:50, and we'll have a question and answer session about 5 to 10 minutes towards the end. Please remember to mute your sound throughout the whole presentation. And we are offering BCBA continuing education units or credits for folks if they want to. I'll be dropping a link to sign up for the continuing education credits about, halfway towards the end of the presentation. So if you want continuing education credits, please just keep an eye out for the chat box. Like I said, your presenters today are Annie Maldonado and Bethany Jorgensen. Annie is a native of Toa Baja, Puerto Rico. She is a school psychology doctoral student at the University of Utah, and she is also a board certified behavior analyst. Annie obtained her bachelor's and master's degree in special education from Florida International University. She served as a special education teacher for students with autism and other developmental disabilities, and is interested in the accessibility of evidence-based interventions for families of children with autism, especially for populations historically underrepresented in research. Bethany is a school psychology graduate student at the University of Utah. She obtained her bachelor's degree in human development from Brigham Young University and is interested in the accessibility of evidence-based interventions for families whose first language is Spanish. We're so excited to have both of you here today. I'm going to go ahead and turn it over to you.
Awesome. Thanks so much, Annie. I'm going to go ahead and share my screen. And thank you everyone so much for coming. As Annie mentioned, we will be presenting on how to address the needs of diverse caregivers of kiddos with challenging behavior. I am Annie.
And I'm Bethany Jorgensen.
And first off, just to begin, wanted to talk a little bit about what to expect as far as the objectives for today. So we are going to review some salient research on interventions that address both challenging behavior in kiddos as well as mental wellness of caregivers. And with regard to challenging behaviors, that'll be with a special focus on children diagnosed with autism spectrum disorders. And we're also going to talk about a framework for developing culturally responsive adaptations, especially for families whose first language is Spanish. And we will also talk a little bit about a packaged intervention that addresses these needs for families from historically underserved communities. I do want to acknowledge that the literature points at a sort of a preference for identity first language from self-advocacy groups, and then a general consensus for the use of person first language by caregivers and professionals. And so given sort of the nature of this presentation and the audience, I will be using person first language throughout the presentation. First off, we wanted to start by bringing your attention to the prevalence rates related to challenging behavior, especially in children diagnosed with autism. And so what we know is that over 90% of children diagnosed with autism do engage in challenging behavior. And I will repeat that again for effect. Over 90% of children diagnosed with autism engage in challenging behavior. And oftentimes these are related to the key diagnostic features of autism. So impairments in social communication and interactions, as well as repetitive and restrictive patterns of behavior. But in addition to these challenging behaviors being related to the key diagnostic features, other disruptive behaviors and challenging behavior in general are also related to non-compliance, aggression, self-injury, impulsivity and hyperactivity, and meltdowns. So something else to consider is that comorbidities or sort of additional co-occurring conditions or diagnoses, they do magnify the manifestations of these challenging behaviors. So they worsen the challenging behaviors, and in addition to that, they can influence the functioning of kiddos or individuals diagnosed with autism. And this can include sort of those daily living skills. And so as we consider that, also consider that 70% of individuals diagnosed with autism have at least one comorbidity, so one additional diagnosis, and 41% have two or more. And these comorbidities encompass sort of a variety of things, but in general, we see some medical conditions like seizures and sleep disorders. We are looking at intellectual disability, learning disability, language impairments, behavioral disorders, some like the ones we just talked about previously, and behavioral and developmental conditions like mood disorders and ADHD. So this is a really, really high comorbidity rate in individuals with autism that then, as I mentioned earlier, kind of magnify those challenges in behavior for individuals with autism. So it's no surprise then that given this high prevalence of challenging behavior in individuals with autism, you would also have parents of children with this condition that are experiencing significant higher levels of stress when compared to parents of children of typical development or even children with diagnosed with other conditions. And these significantly higher levels of stress are also occurring at what we say clinically significant levels, which really simply put means that these levels of stress are impacting functioning, sort of everyday life at home and at work of these caregivers. And so as we consider sort of the impact of challenging behavior and parenting stress on children and also parent outcomes, it's really important then to look at the literature to really determine what types of interventions have been shown to work, to be effective, to be feasible, to be sustainable when addressing these needs.
So a number of interventions have demonstrated success in managing and decreasing challenging behavior in children with autism spectrum disorder and decreasing parental stress. Three we would like to highlight in particular are applied behavioral analysis, behavioral parent training, and acceptance and commitment therapy. One approach that has a substantial evidence base is applied behavioral analysis, which is a process for understanding behavior, specifically why it happens and how to modify it. Understanding the various environmental components that impact behavior can lead to an increased understanding of the factors maintaining that behavior. Namely, behavior analysis seeks to identify the antecedents that trigger the challenging behavior and the consequences that maintain that behavior. This is done through the process of functional behavior analysis. Interventions that are based on functional behavior analysis allow for successful identification of the reason an individual engages in a behavior, which can then provide a way to replace the challenging behavior with a more socially appropriate and acceptable behavior that still meets its function. Ultimately, intervention procedures that are based on principles of ABA help to decrease problem behavior while increasing adaptive behavior. The next intervention that we'd like to highlight is behavioral parent training. Studies involving caregivers in the intervention process, especially by having them deliver and implement interventions in home and community settings, have demonstrated the importance of parent engagement in the therapeutic process. By implementing parent-mediated interventions, key diagnostic traits as well as maladaptive behaviors can be targeted in the child's naturalistic setting. We have also seen through research that when parent training interventions are used, that child behavior improves in multiple settings because the skills the child learned are more generalizable to other settings. A behavioral program that we would like to highlight in particular is the Ruby Parent Training Program for disruptive behaviors. The Ruby Parent Training Program is a training program that has been empirically validated and has shown to decrease parent stress increase adaptive skills of the children, and significantly reduce disruptive behaviors. Further, researchers have found that improvements in disruptive behavior lead to enhanced daily living skills, especially in children with higher cognitive abilities. The current manual is modified from the version used in the RUPP Autism Network trial for use as a standalone treatment for preschoolers with ASD and disruptive behaviors. A pilot study with 16 children ages 3 to 6 years old with ASD showed solid acceptance by parents and reliable treatment delivery. This modified manual was then tested in a large-scale multi-site trial of 180 children with ASD between the ages of 3 and 7 years old. Subjects were randomly assigned to a parent training intervention or a structured parent education program for 6 months. On the parent ratings of disruptive and non-compliant behavior, children in parent training showed significant improvements compared to the control group. Independent evaluators classified 69% of children in parent training as positive responders compared to 40% in their parent education group. Since first being researched through a randomized controlled trial, they have adapted the manual and implemented it across a number of different settings and communities and populations. They have started using the parent training program with paraeducators, and they have also in Missouri have started implementing it with Spanish-speaking families. And additionally, research in Ruby has also explored its effect on parental stress, and some studies have found a positive impact on parent stress. However, there have been mixed results. So the parent training manual itself in the Ruby parent training program consists of 11 core sessions, as well as several optional sessions to meet the needs of specific children. The core and optional parent training sessions are 60 to 90 minutes long. And although both parents or caretakers are encouraged to attend the parent training sessions, one parent or caregiver is expected to be the mainstay and to attend every single session. The core and optional sessions should be delivered weekly. So the next intervention that we would like to highlight is acceptance and commitment therapy. A number of studies have explored interventions addressing parental stress of families with children with autism spectrum disorder. And one that is particularly well-researched is acceptance and commitment therapy. One of the principal outcomes of acceptance and commitment therapy is psychological flexibility. Psychological flexibility refers to how a person adapts to fluctuating situational demands, reconfigures mental resources, shifts perspective, and balances competing desires, needs, and life domains. Because ACT emphasizes psychological flexibility and developing a flexible approach to finding solutions, we hope that as parents use ACT that they will ideally also become more open to trying new methods of addressing challenging child behavior, even in the face of psychological stress. Saarinen et al. Found that parents of children with chronic conditions who use a web-based ACT intervention displayed decreased symptoms of burnout and depression and increased mindfulness and cognitive diffusion. Cognitive diffusion is noting thoughts rather than getting caught up or getting buried in or buying into them. It's also letting thoughts come and go rather than holding on to them and getting absorbed by them. And so we hope that as we incorporate ACT therapy into our own intervention, that our parents will also experience decreased symptoms of burnout and depression, increased mindfulness, cognitive diffusion, and psychological flexibility. So ACT has been used in research and clinical practice in 3 different ways with parents. First is to address parents' psychological well-being. Second is to augment existing behavioral parenting interventions. ACT in particular has been used with parent-child interaction therapy and with Stepping Stones PPP, which is a parenting intervention for families of children with neurodevelopmental disabilities, and to directly address parent and or child behaviors. So a few studies have examined the delivery of behavioral parent training in combination with intentional mental health supports to address problem behavior and to improve mental wellness. Researchers who have engaged in this line of study found that there is a need to systematically address both parent management of child challenging behavior and to also address parental stress at the same time.
So one thing also that we wanted to note, and Van Dyke and his colleagues back in 2004 found, they found some disparities in access to healthcare services, specifically for non-Hispanic Black families as well as Hispanic families. And in addition to that, they also found disparities for those who did not have a healthcare insurance, those with lower incomes, and those who whose child sort of was greatly impacted by their disability. And so we know then that families from minority backgrounds do experience a lack of evidence-based interventions and services, and specifically interventions and services that are culturally relevant to them. And so this sort of cultural relevance that we're talking about is generally kind of comes back to language or cultural competence of in the service provision in general. And so I think that in addition to sort of this gap that we've established in the disparities of services provided for families from minority backgrounds, there's also another reality that kind of compounds this, and that is that the US is growing more racially and ethnically diverse. I'll bring your attention to the table here on the screen to note that we are expecting that between 10 to 30%, that there will be between 10 to 30% increases in population from individual Black and African American, Hispanic or Latino and Asian groups, while increases in those, but still sort of having white families remain at 1%. So we're seeing these increases, 10, 20 years down the line for families from underrepresented backgrounds or minority backgrounds. And so simply put, the US is growing more diverse, and is important then that we as sort of educational psychology service providers are then helping to address this growing diversity. And this diversity is most evident in children under the age of 18. So I'll bring your attention to the left side of this graph, where you can see the percentage of racially and ethnically diverse youth across the next 40 years or so being sort of estimated or forecasted. And it's estimated then that there's going to be an increase across various minority groups, but a decrease across whites. And so again, we're seeing more diversity in our children over the next 40 years or so, especially when compared to adults ages 65 and older. And so the question then becomes, how do we address this growing diversity and the disparities in services? And the answer is just by developing culturally responsive approaches and adaptations for interventions that are already existing. So we don't need to recreate the wheel most of the time. We just need to make these interventions be more culturally responsive and adapt them to the families that we're wanting to serve. So for the rest of this presentation, we're going to focus then on discussing sort of a framework for developing these culturally responsive adaptations for diverse families. And one thing to consider is that most cultural adaptations currently existing, those models are stressing more of a multi-stage process. And that's what we are considering to be best practice, sort of looking at sort of phases of creating these interventions to be more culturally adaptable. So the literature, as we look into this, the literature already has established sort of what those interventions that are effective and have consistently and reliably shown the same results, those evidence-based interventions are. And so it's important that we then identify those evidence-based interventions and programs that are going to match the needs of those families. And so we're talking about interventions that might help with challenging behavior, with food refusal, interventions that are going to help with educational academic outcomes. So matching them and identifying them that way. But also it's really important, and something that we also see in the literature is the importance of addressing the needs, of understanding the needs of the target community that we're wanting to serve, as opposed to simply assuming that we know what their needs are. And so that's where a needs assessment comes into play. And that's going to help to identify and address the gaps in service provision that we're seeing across the board in some of the interventions that we're providing. So first, the other thing that we want to talk about is, so we're identifying those evidence-based interventions that are going to match the needs of the families or of the child. We're conducting these needs assessments to really get an understanding of what these needs are, what the services gaps are. And then with regard to making interventions sort of more linguistically responsive, it's really important that we're then following those guidelines that have been established when it comes to high quality translation and just broad adaptations in general. And the National Research Center on Hispanic Children and Families has created a really, really nice resource that kind of lists out all of the different considerations when adapting interventions, and that's where this content is coming from. But also, and I have a link to that at the end of the presentation. But I think in addition to that, having an understanding of what the literature says. So if there have been interventions that have been implemented with a particular group, then kind of looking at those interventions and learning from those past studies and sort of knowing what has worked and what hasn't, and creating this iterative just process where we're constantly using what we've learned, but adapting and making changes as we monitor the progress of these interventions and the outcomes that they're helping to facilitate in families and children. And then one other thing to consider, which is very important, and it kind of goes along with conducting these needs assessments. The reason we're conducting these needs assessments is to be able to understand the specific needs and address those needs with information coming directly from the families, coming directly from the community that we want to address. And I think that having a team member that is most familiar with the unique needs and characteristics of that target community is going to be really important, right? So going back to not just assuming that we know what those needs are, but really connecting with stakeholders, with caregivers, with individuals that are coming directly from the community who are able to help guide the process for adapting these interventions. And that's going to be another really critical piece. And then here in the end, we're looking at pilot testing these newly adaptive materials or interventions before implementing them more broadly. And I think that when we think about pilot testing, we automatically think research, which often is true. We're kind of testing out the waters to see how it works. But at the same time, pilot testing is about rehearsing, right? So being able to try out these newly adapted materials with a small group of individuals, and then kind of seeing what the response is and seeing what we learn from that rehearsal, from that process, to then make those small tweaks and then be able to, again, address those adaptations in a way that are going to be successful with the target community. So pilot testing is very important as well. So over at the College of Education and Human Services at Utah State University, Dr. Dominish Rodriguez came up with she's very interested in adapting different interventions, but specifically parent training type intervention with families who speak Spanish. And so she sort of came up with a cultural adaptation process model that kind of follows these other items that I listed out here. But one thing that she mentioned that I think is so critical and even beyond just wanting to adapt interventions for culturally and linguistically diverse individuals, just like best practice for everyone, is making sure that you are reviewing the process, right? Looking at what changes can be made to make that adaptation better. It's not just about adapting it or creating it one and done, moving on, kind of continuing the process, but rather it being a continuous process where you're going back and forth and testing out to see if this is something that works with a community, how they're responding to it, and making those changes as you're implementing it. In one particular study, Dr. Dominique Rodriguez implemented this parent training intervention in Spanish. And it was involving applied behavior analysis as well. And there was specific vernacular that she was trying to figure out what the best language would be for some of the translations or the interpretations of specific behavioral language. And they were having a conversation about timeout, right? So what would be the best interpretation or translation for the word timeout in Spanish? Something that she found out very quickly by having conversations with the community and with the parents that she was working with is that for the families themselves, timeout was perceived more as an American concept. And to them, translating it into Spanish didn't really make a whole lot of sense. To them, they preferred sort of keeping the word timeout in English intact and just saying timeout when they spoke about it, because to them, it was a concept that was more of an American concept. And so that would have been something that she perhaps wouldn't have been able to find out had there not been this sort of emphasis on this adaptation iterations and talking to families and really getting a sense of what their needs are and what their perspectives are, which I think is a great, is an important piece of adapting interventions. The other concept that I want to talk about, or the other model, and this is sort of where that cultural adaptation process that Dr. Dominique Rodriguez discussed in her study came from, and that is ecological validity model. And we might spend a little bit more time talking about this piece because I think it's really important. And I do want to say that although we are talking, Bethany and I, about specifically families who speak Spanish, this is a model that can be used with just cultural and linguistically diverse individuals and adapting interventions specifically to encompass and to address the needs of those that perhaps the intervention was not really created for initially. So the ecological validity model was developed by Guillermo Bernal and his colleagues back in the 90s at the University of Puerto Rico. And the framework itself that he created was more to provide an actual structure for adapting interventions that would sort of emphasize that ecological validity. Now, ecological validity refers to sort of the degree with which the intervention itself, as experienced by the diverse individual, is actually the same as the intervention that the researcher intended it to be. So in other words, does the intervention work in the real world with people with different cultural contexts? That's what ecological validity means. Are these interventions that we're creating with the purpose of, helping with X outcome actually also successful with these individuals that are culturally and linguistically diverse? And I think that is sort of the key aspect of how to adapt interventions and why we're even adapting interventions, right? And so one thing that Dr. Bernal and his colleagues developed within this ecological validity model were the 8 dimensions of ecological validity. And if there is anything you take with you today from this presentation, is these 8 aspects or these 8 dimensions of ecological validity model. First, language. And as we discuss sort of language, we're talking about how a good adaptation will ensure that language used is used in the context of the treatment, is understandable, is culturally responsive, is culturally appropriate. And that takes me back to sort of that example of Dr. Domenice Rodriguez coming up with like, well, maybe we don't have to translate the word timeout because there isn't an actual word for it. But there also were some other examples of words, and I'll give a really brief example of the word praise. In Spanish, one translation they thought about was alentar, which kind of means to praise. But at the same time, for many Hispanic, Latino, or Spanish-speaking families, alentar sounds too much like aliento, which means breath. And so they were getting sort of confused. What do you mean alentar? That really means breath. Like, what are you talking about? And so kind of going back and forth with the families through that pilot testing process to really get a sense of what those actual words would be, or what the language should be. In terms of person, so the second dimension, Bernal asks, are clients comfortable with the therapy relationship? And are they comfortable with the similarity or the difference in the ethnicity of the therapists, right? Very important questions around how comfortable are the client or the patient or the student with the therapist that they're working with. I think many of us in the school psychology program here at the U got a chance to attend the Utah Association for School Psychologists conference, and Dr. Jones was there, and she was talking about a little bit about giving examples of some of her own students, school psychologists in training, whose race and ethnicity did not match the clients that they were working with, and sort of being a little afraid to say something about it or to bring it up in therapy. And then finally, when it was brought up, sort of having the individuals, that the clients feel this sort of relief of like, finally they see me, and so I think that being able to understand or to pause and think about is the similarity or difference between me as the therapist or me as a service provider and my client or my patient. Is that something that is something that they're comfortable with? And if not, what kind of conversations can we have or should we have to make it more comfortable, if possible, right? The other aspect or the other dimension of ecological validity model is metaphors. And there are two primary questions that we think about when we think about sort of how to make metaphors or how to make interventions more culturally and linguistically appropriate in terms of metaphors. And that is, do sayings or dichos in Spanish, are they sort of more common to Latino or whatever community it is that you're working with? Are they more common to them? Do they appear more to be more common for those individuals within the manual? And are symbols associated with those individuals part of the treatment environment? So one example that I have about this is there is a saying that, again, Dr. Domenice Rodriguez used in her own research with just parent training and behavior training, that said in Spanish, el que persevera alcanza, which if you translate that into English, it means he who perseveres conquers, right? And in Spanish, that dicho or that saying is very common for us, el que persevera alcanza. But in English, it sounds a little odd, right? And so if we start thinking about what might be an actual culturally appropriate saying in English that kind of matches that one in Spanish I just mentioned, it might be something like, good things come to those who wait, right? And that might be something that maybe more people are more familiar with. So we can think about it from that sense, but reversed, thinking about it from the sense of, we might be translating really good metaphors. And we're like, yeah, this metaphor is awesome. But then when you translate it into whatever language it is that you're, of the community that you're working with, it just loses total meaning. And so I think that making sure that these sayings and these symbols are associated with or are common for the community that you're working with. The other piece is the content. And in terms of the content, again, there are a couple of questions to ask. Does the treatment manual use case examples that reflect, common values and other issues related to the group that you're working with? So in our case, the Latino population, right? And it's kind of related to that. Does the patient or the client feel that the therapist respects those cultural values? So kind of going back to the values of the community, and in our case, sort of being aware and knowledgeable of what those values might be. I think it's important. That's where that cultural competency comes into play, just kind of being aware of those values. And again, that's also where that individual who may have a unique knowledge of that community could come into play when you include them in your team, when you're adapting these interventions. When it comes to concepts, the treatment concepts in the ecological validity model are thought about for the relevance to the culture and sort of the context of the culture. So some questions that we can ask about that are, does the client understand the problem and the reason for the treatment? Do they agree with the definition of the problem and with the specific treatment? It might be that in our case, we're sort of Western tradition, or the United States of America having more of an independent way of being, whereas maybe in other cultures there might be more interdependence or more dependence, right? And so being aware again of those things and understanding that when you're working through to find out how to address a problem, sort of as challenging behavior, it's important to be able to ensure that these cultural values are kind of at the forefront and constantly addressing and constantly shining a light on how we're problem solving through these. The other thing is goals. And when we think about goals should focus on sort of transmitting that positive, adaptive cultural values. So some specific questions might be something around, is our treatment goals framed within the adaptive cultural values of the patient? Are these treatment goals consistent with cultural expectations of the therapy or the intervention? And does the patient agree with the goals? Again, if we are the ones setting up the goals and we're not aware of the patient's cultural values or even just goals in general, then it might not be, that therapeutic relationship won't be successful. And then as we think about the methods, are the clients sort of in agreement with the methods for treatment? Are these things that they're accepting of or willing to sort of work through? And then with context, some guiding questions is, does the treatment manual consider contextual issues? And I feel like this is a big one out of the 8. I mean, all of these are important, but when we think about the 8th one, contextual issues for that particular culture, such as migration, such as acculturation stress, such as social supports, family relationships in their country of origin, barriers to treatment that are common to Latinos or Asians or African American Black families or clients. Is transportation or reminders for sessions, is that an issue? Is that something that should be talked about ahead of time and sort of problem solved through? Are the therapists sort of having more of a caring view of their social and economic situation? These are all things that might be very different for individuals from culturally and linguistically diverse backgrounds. And so it should be at the forefront of everything we think about when we're adapting these interventions to meet their needs as well. So these were the 8 dimensions of the ecological validity model, and very, very important. The other piece that we want to talk about is project piece. And this is more of that packaged intervention that we're wanting to incorporate within the program. It stands for Parents Effectively Addressing Challenging Behavior in Español. And in general, it's, parent training and psychoeducation impacts parents' ability to manage their kiddos' challenging behavior and even their own mental health wellness. And so what we do know, based on what all we talked about, was there's limited research. So interventions for families from historically underserved communities, there isn't a whole lot that has been done. I mean, there is some literature that talks about it that we can learn from, as we talked about earlier, but a lot more needs to be done. And then there needs to be ways to systematically address these, challenging behavior and mental health mental wellness for parents or caregivers combined, so sort of simultaneously. So when it comes to this current study, the Project P study, there are a couple of things that we're doing. We're incorporating, as Bethany mentioned earlier, the Ruby manualized intervention, and we're also incorporating ACT. And so the idea is to be able to blend the two so that parents are then effectively learning to manage challenging behavior in their kiddos, while also effectively learning to manage their own parental stress. And as Bethany mentioned earlier, the core sort of key aspect that we want to get out of ACT is psychological flexibility, which will make us more open to be able to try new things that we maybe haven't tried before. And so being able to put this together with this parent training protocol will help to have parents learn about behavior management, while also making them more psychologically flexible to be able to try these new things. And these are just sort of the different concepts that they would be learning. The project itself is a 6 to 8 week brief session. So during the first session would be more of an intake, and then after that they would be learning about ABA concepts, as well as some of the 6 dimensions of acceptance and commitment therapy. So in general, the study is meant to examine the effects of the parent behavior training in combination with the strategies that are going to address parent stress, while also sort of making sure that the parents are correctly implementing evidence-based strategies and also measure parental stress and child challenging behavior.
So now we just wanted to go over the process that we're going through to create Project Peace. So first, we formed a collaboration with stakeholders in Albizu University, which is located in San Juan, Puerto Rico, and also a collaboration with the University Developmental Assessment Clinic located in Salt Lake City, Utah. And they're helping us to recruit participants and to also address linguistic and cultural disparities in the intervention package. Next, we created a specific needs assessment. In order to determine specific needs of our parents to be addressed via the intervention, content, and methodology, a needs assessment will be administered to parents of children with autism within the broader San Juan community. The needs assessment includes questions regarding the specific behavioral and emotional supports that these families of children with ASD need. And additionally, given the historical problems with the electrical grid in Puerto Rico, additional questions will be addressed to help us determine the best methods of delivery of the interventions and technical supports needed to implement this intervention with the people in Puerto Rico. The third thing that we did was we created some culturally and linguistically relevant videos and examples to be used with the parents. And the videos will be in Spanish and will incorporate culturally and linguistically sensitive examples that will help to implement the intervention. The fourth thing we did was we adapted the intervention. So the adaptation of the package intervention includes the Ruby parent training program, specifically in Spanish, and then also incorporating that ACT therapy component to help with parental stress. And then the last thing is that We also have received funding from APBS, a grant that will help to compensate the participants in our intervention. We know that it can be difficult to set aside time to receive these services, and we don't want money to be an issue. And so we have gotten a grant to help compensate the parents so that they can come and participate in this intervention. And our intervention will start out with a pilot study in Salt Lake City at the UTTEC. And then that will be a 6-week intervention. And then later we hope to implement this intervention in Puerto Rico.
Okay, so I'm going to actually stop sharing for a minute so that I can also share the videos that were created just to give you guys a little bit of an example of what they look like. Just to show you all the original version. So the original versions, let's see this first one, actually.
Can I have a brownie?
Oh, not right now, honey. All right, it's lunchtime.
But why?
Because it's lunchtime. It's not time for brownies.
Open it.
I said it's not time for brownies.
Open it.
Don't.
Open it.
All right, you can have one brownie. That's it now.
Right, so these videos were made to be able to show examples and non-examples of how to address challenging behavior. And so with the help of the UTTEC lab, we were able to create these with Spanish voices and create characters that are going to be more culturally sensitive to the individuals that we're going to be working with.
Mami, yo quiero una galleta.
Observa el siguiente escenario. Trate de identificar el antecedente, el comportamiento y la consecuencia.
Ahora no, corazón. Ya vamos a comer, así que espérate un ratito.
¿Por qué? Yo quiero una galleta.
Porque vamos a comer y no es hora de comer galletas.
Ábremelas.
Ya dije que no es hora de comer galletas.
Ábremelas. Ábremelas.
Está bien.
Yes.
Te puedes comer una, pero una sola galleta. Toma.
Galletas, galletas, galletas.
Ay.
So something you may have noticed is that we changed brownies to galletas or cookies because there really isn't, it's not a very culturally sensitive aspect of something, of an example to use with this particular population. And then, as you saw, kind of change the characters again to make them more culturally sensitive. So that was part of sort of the intervention changes. But that is what we have. If you have any questions, we would love to hear them. And as promised, here is that resource about developing culturally sensitive approaches to individuals who are diverse.
Thank you so much, Annie and Bethany. That was a great presentation. Kind of like what Annie said, now is the portion where we open it up for any questions. You feel free to drop your questions in the chat box, or you can hop on. I did drop a link for folks who do want to receive BCBA CEUs for this presentation in the chat box. I will go ahead and just drop it in there just in case you don't see it. But yes, any questions?
So I see Dr. Pompa mentioned, would there ever be a need for to subtitle the videos in English? I think one thing that we did actually was reach out to the first author of the Ruby manual. And one thing that she mentioned is that Ruby is actually being implemented in Brazil with families who speak Portuguese. And so they also reached out to her about, are there videos in Portuguese that we can access? Unfortunately, there weren't, and so they began using subtitles with the same exact video, and which is a great way to be able to still access the content. But when we think about sort of the equity of that access, is a little bit different, right? So families are not seeing people that look like them. Their families are not hearing the content in their language. They're having to sort of read through some of this. When we think about sort of different aspects of that for families who may not have reading abilities at a level where they're able to understand the content, right? We have to think about all of these things and sort of making sure that the accessibility that we're creating is equitable, and it's something that can successfully allow families and clients and children to be able to access it in a way that is very similar to, right, very ecologically valid when compared to how it was first created, the intervention. So it's a great question. And I think, of course, not to shame subtitling, right, and captioning, because it's a great tool to have, but just sort of thinking of ways to go beyond that and making it more equitably accessible. I'm gonna stop sharing for a minute so I can better see everybody. And if there are questions beyond this, I'll just put my email on the chat in case anybody ever wants to reach out.
Again, thank you so much to our presenters today, Annie Maldonado and Bethany Jorgensen. Our next webinar will be in January, so after the new year. To find the most up-to-date information on upcoming webinars, you can follow the UTTEC Lab on social media or visit our website, which you can access by going to u-tteclab.com. Again, that's u-tteclab.com. And again, thank you so much for joining us today, and we hope to see you in another webinar.
Thank you all so much.